So, what I want to talk to you about now is due dates. This single date that you've got inscribed in your mind, that you've got written in your diary, decorated with stars. Everyone in your family's got written it in their diaries. Actually, only 4% of babies are born on their due date, which means there's a 96% chance that this will not be the day that your baby is born. If you take that date and you add 7 days to it, that would be your due date if you lived in France. So there's not even a worldwide consensus as to where due dates should sit. So, where did due dates actually come from? Now, in terms of research, it goes back to a bit of research that was done in the 17th century on 200 women. The doctor that did the research said that pregnancy lasts for 40 weeks. He didn't state whether that was 40 weeks from the first day of your last period or 40 weeks from the last day. In France, they use the last day. In the UK, we use the first day. We used to use the last day until the early 1900s, and then for some reason it changed. This is also based on someone with a 28-day cycle, which of course not everyone has. So essentially there's not a very good rule as to where we should be counting these 40 weeks from in the first place. Then we have a scan, and this date often changes again. Some clinicians believe that scans may be slightly more reliable when it comes to choosing an estimated due date, but there isn't really any good evidence to say that they are. But actually, more recent research has shown that pregnancy gestation in humans is different from woman to woman, and it's influenced by all kinds of things, from height to ethnicity to whether you've had a baby before to other genetic factors, including the genetics of the biological father of the baby. So one woman's pregnancy may last 38 weeks and another woman's pregnancy may last 42 weeks. Throw in the fact that we don't know when somebody conceived specifically, and you've got a really big window of when might be a normal time for a baby to arrive. So the World Health Organization guidelines state that a normal length of pregnancy is anything from 37 to 42 weeks. And we know that some babies will come both before and after that window. More recent research has shown that for first-time mums, 50% of women will have given birth by 40 weeks plus 5 days, and second time it's 40 weeks plus 3 days, which means that at 40 weeks plus 5 or plus 3 days, 50% of women still haven't gone into spontaneous labour. So if you're watching this video and you're beyond 40 weeks pregnant, you are in very good company. Now, the reason we want to take away this focus on this single date is all to do with the stress that it causes. As soon as we're 1 day past this date, we start talking about our baby being late, even though they're well within a recognised normal window of pregnancy. As soon as they're 2 days late, we say they're 2 days late, they're 3 days late, and we start asking, why haven't they been born yet? What is going on? What's going on with my baby that I haven't gone into labour? Will I ever go into labour? And we start Googling world's longest pregnancy and has anyone ever been pregnant forever? And these thoughts are causing stress within our bodies. Now, the second place that stress comes from is our well-meaning friends and family who, if in the last few weeks of pregnancy haven't started texting you already, the day your due date comes, they will want to know, have you gone into labour yet? Have you had your baby yet? Where's your baby? Any twinges? Any sign of labour? Like you'd have been sitting at home for a week with a baby and not bothered telling anyone that they'd been born. So if you're lucky enough to be watching this video early on in pregnancy, then just tell everybody now that they've changed the due date, put it 2 weeks later, and it alleviates some of the stress that you might face later on. If you're already later in pregnancy and you can't quite get past this, then it's just a simple request to friends and family, stick something up on social media, send an email around, just ask them not to bug you about it. So just, please don't text me, please don't ask when my baby's born. We will let you know as soon as they have arrived. And the final place that stress can start to come from is from your healthcare providers themselves. So from 40 weeks, most healthcare providers will start talking to you about induction, if not before. The current UK guidelines mean that you will be offered an induction at some point after 41 weeks of pregnancy. Almost 40% of labours in the UK are induced. If you're watching this a few years after it's been recorded, I think we can confidently assume that it will have continued to go up and up year on year. When we include the rate of planned caesarean birth, less than half of women are given the opportunity to go into spontaneous labour. 70% of inductions are done for dates, so a baby not being born by 41 weeks. Yes, even though we know the expected length of pregnancy is up to 42 weeks. So if you're at your 40-week appointment and they start talking about induction of labour, what's important to know is that you never have to have an induction. It is always your choice. If you've got to 41 weeks of pregnancy and you decided that you didn't want an induction, then you don't have to have one. A small number of pregnancies will last longer than 42 weeks. If you got to 42 weeks of pregnancy and you didn't want an induction of labour, you don't have to have one. If you wished, you could request an extra scan, an extra monitoring of your baby. So the scan would look at things like the fluid level around the baby, the placental function, the cord to check that the blood is going to and from the baby in the way that we would expect, and checking of all of baby's organs to check that everything is functioning normally. Though there is also a chance a scan this late can pick up a problem where there isn't one. So it's up to you. The monitoring would usually be at least twice weekly, but sometimes hospitals will offer it more often than that. And that's just checking baby's heart rate, checking that they are all happy and healthy in there. I would anticipate facing quite a lot of pressure to induce labour if you're attending hospital frequently beyond 42 weeks. So you might want to take somebody with you to help advocate for you if you feel that this might impact your stress levels. You could also instead request a caesarean birth if you didn't want an induction of labour, but also didn't feel confident waiting for labour to begin. Or you can simply decline induction and scans and wait for labour to start on its own. You can use your brain tool to help you decide whether an induction for dates feels like a good choice for you. But remember, until 42 weeks, you're well within this normal window of pregnancy. And beyond 42 weeks, the risks that we are talking about are very, very small. I do think it is important to address what these risks are, as they would come up in conversations with your care providers. So the reason that induction is offered between 41 and 42 weeks is because of a small increased rate of stillbirth within the general population after 42 weeks. The research around whether induction actually reduces this risk is mixed and complicated, and it's important to remember that these are population-based guidelines, not a recommendation being made for an individual woman based on her individual circumstances. I would really encourage you to go and read Dr. Sarah Wickham's work on this topic. She's got a couple of books if you're keen to dive a little bit deeper, and links to all of those you'll find in the course companion. It's important to note, however, that whilst the rate of induction has shot up tremendously in the UK in the past decades, we haven't seen such a huge impact to the rate of stillbirth, suggesting that any change cannot be wholly attributed to the massive increase in inductions of labour. It's going to be a very individual decision as to whether the risks associated with a pregnancy that goes beyond 41 or 42 weeks of pregnancy outweigh the risks associated with an induction of labour for you or not. And it's a decision that only you should get to make. Not me, not your doctor, not your friend, not your midwife, you. So why do we want to avoid stress in these last few weeks of pregnancy? Well, it all goes back to the hormones again. So when your baby has finished cooking, they've completely finished growing, the last part of their body to finish growing is their lungs. When their lungs are fully developed, we believe it releases a protein into the amniotic fluid, which sends a message to the uterus to start labour. If your body is ready to go into labour, so it's full of oxytocin, you're hanging out in this calm part of your nervous system, then off you go, labour starts. If we're hanging out over here and our body is full of adrenaline and cortisol and our stress hormones, then it receives this message from your baby saying, ding, I've finished cooking, I'm ready to be born. And it sends a message back to them saying, okay, I know you're ready, but there's fire and dinosaurs and all kind of dangerous things out here now. It's not a safe time to be born, and you don't go into labour. So my best tips for those last few weeks of pregnancy are to distract yourself, relax as much as you can, and just do anything that's going to make you feel happy and help you produce oxytocin. If trying to go into labour is making you feel stressed and anxious, then stop trying. Book cinema tickets, go out for lunch with your friend or your partner, do something that's going to distract you and make you feel happy. Have something booked in for every single one of those days beyond 40 weeks of pregnancy. If you have to cancel because you're having a baby, then great. If you don't have to cancel, then at least you've got something nice to do that day.